Hello, everyone. We are here with Camille Schrier, who is Miss America, and I am delighted to be able to sit here and ask lots of questions that we've all wanted to know about what it's like to be Miss America, what it's like to do that living with Ehlers-Danlos syndrome. So we're going to read some questions, and some of them are sent in direct from the community, and some of them we've pulled together and summarized what a lot of you have been wanting to ask. So, Camille, what made you want to create an initiative like Mind Your Meds, Drug Safety and Abuse Prevention from Pediatrics to Geriatrics? And why is medical safety in particular so important to you?
That's a really awesome question. I created this initiative partially because I'm a pharmacy student. So I learn about how to be a pharmacist through my education. And I also grew up with a mom that was a nurse. And so she was always very cognizant of everything that she was giving me and putting in my body, because she knew as a nurse that, you know, medicines are intended to help us, but they can also be of harm if they're not used correctly. So I grew up with that knowledge. And then when I went to pharmacy school, I started to really see that firsthand. I was learning how to educate patients, learning how to educate parents on, you know, how to give their children medications. And I saw such a margin for error in that for parents and for anyone who was a caregiver. And quite frankly, from other people my age who didn't know how to properly take medications safely. So when I started competing in the Miss America organization, I was challenged to create my own social initiative that I would work to advance throughout my time in the program. And it was an easy choice to choose that. And we also have a huge opioid epidemic here in the United States, but also it's something that is really affecting our world just globally right now with opioids. And that is another piece that I am really passionate about tackling, because much of the opioid abuse that happens is from prescription medications originally. And so it's important for us to be so cognizant of the power of the medications that we can take, because they really can help us, but they can also harm us if we're not being very careful with them.
Yeah, absolutely. And have you found it difficult to continue raising that awareness virtually due to the COVID-19 pandemic?
It's very difficult to keep that momentum going. Part of it is that, you know, I want to be timely. We have other things that are happening in our country right now, so many things. But it's also important to remember that despite COVID, despite social unrest, 130 people a day in the United States lose their life to an opioid overdose. 130 every single day. And that doesn't just stop because other things are happening. And so to continue to make people aware that this is a continued problem and it's not getting any better, I'm hoping that everything that is happening in our world doesn't work to overshadow that, because right now, as people are especially, you know, in turmoil in their own personal lives, maybe people are facing addiction and they're trying to find a way to cope with what they're going through right now. This is a hard time for people and opioids in our country. So I continue to try to shout it from the rooftops the most I can virtually, but it's been difficult to continue on a virtual platform, more difficult than the other pieces of my job that I do that I can transition virtually, but I'm trying to make it work.
Amazing. No, it definitely is a challenge. I think we're all learning day by day how to overcome those challenges that are being presented. And it doesn't seem to have an obvious end to it either. So it's learning to adapt long term to this new norm. And
Absolutely.
Could you tell us a little bit about your EDS diagnosis journey?
So unlike most people that I have talked to, I had a really streamlined diagnosis, which probably seems crazy to most people with Ehlers-Danlos who are listening to this. But I was diagnosed kind of by accident. Of course, not completely by accident. I went in for a normal screening for scoliosis when I was in middle school. I was probably 11, and my school nurse said, "You have scoliosis, I'm pretty sure." So she, of course, reported it to my parents, and my parents weren't surprised because I have probably every cousin on my mom's side has scoliosis, some really severely. And so I went to an orthopedic surgeon who was going to monitor me as I grew for my scoliosis. And I remember getting there for the first visit. And he kind of examined me and he was like, there is something else that is happening here that is more than just scoliosis. And he was a very smart orthopedist. And he looked at me and he touched my arms and he touched my hands and examined my joints and measured my flexibility. And he was like, you have Ehlers-Danlos syndrome. And he's like, I think one of your parents probably does too. And he said, you know, likely one of your two parents sitting here also has it and gave it to you. So if it had to do with flexibility, the obvious choice was not my dad. So he went over to my mom and was like touching her arms and hands and realized, you know, I think you might be the one that gave this to her. So we went to a geneticist. This was back in probably 2007. And those of you who are keen into the sciences know that between 2007 and 2020 is like light years in terms of genetics and science. And so we did not have the same kind of genetic testing when I was first diagnosed. So I was diagnosed just based upon my symptoms. And I had been told that I had Ehlers-Danlos classical type 2. That was also before they reclassified, which I think happened a few years past that. But I have a very mild form, and I'm grateful for that. I do not have the vascular type, which is what we immediately had to rule out because that was the first thing that they wanted to make sure that they knew if I did or did not have. And my mom was also diagnosed at the same time. And for her, that answered probably 45 years of questions. It gave her peace through 45 years of misdiagnoses that made her feel like she was crazy. Had doctors tell her that she had so many different ailments that really probably were all Ehlers-Danlos, and doctors who thought that she was faking her symptoms. But in reality, I think a lot of us faced what my mom faced, and I was grateful that my diagnosis at a younger age was able to give her some information that she needed, but also allowed me to go through my life with a little bit more knowledge of why certain things happened to me that didn't happen to other people. But I think it's really important, especially as someone going into healthcare, to recognize that symptoms are not always for an obvious reason. And we see that zebra that represents Ehlers-Danlos and rare diseases. And I constantly go back to that and remind people that don't always just assume the obvious when you see something. You know, that's how that story was created in terms of, you know, hearing hoofbeats and expecting to see a horse. And that was how medical professionals were trained. But sometimes those hoofbeats are actually from a zebra. And so it's important for me to share that story through my time as Miss America, but also as someone who will be in the healthcare field one day.
Amazing. And I think people underestimate how important that validation really is. It can mean so much and give such peace of mind when you've been, you know, on a long diagnostic odyssey, which I'm delighted that you weren't. Do you think that the fact that your diagnosis came quite early has meant that you've been able to have a better quality of life in terms of symptoms because you've been able to preempt things and not be on that long odyssey?
I absolutely think so. I am a huge advocate for preventative medicine. I think that that's something that we really need to focus on as a society in so many ways. I mean, from things just from basic nutrition and rest and getting enough water that are just basic needs that a lot of us with our busy lifestyles just think is not a big deal. Of course, we can just cure it with medicine, which is a lot of the attitude that I think that people take on because we have these powerful medications that we can take, but it's a lot easier if we just don't get to the point where we need to do that. So I think I, you know, had a huge advantage. I started physical therapy, started understanding my injury potential from a really young age. And quite frankly, I think that that is the difference between looking at someone like my mom who didn't have that opportunity, who got constant injuries, had to have surgeries, has had consistent, you know, problems and injuries throughout her body because she played sports throughout high school and impact sports, basketball and all these things. And so she consistently has more pain than I do. Of course, we also have an age difference, but I have been really lucky with my pain level and my management of my symptoms. The biggest problem that I have is being a student and knowing how to manage my energy levels, because I definitely have, probably my most prominent symptom is fatigue. and I do struggle with fatigue and trying to stay focused and awake and alert more than my peers. And that's something that I have to be very cautious to be able to manage, both as a student and doing my job as Miss America. And so it's easier to know that and go in and change the way that you are going about your day, or change certain pieces of your life to adapt to that. Because quite frankly, this is a disorder where there's not, at least in my situation, there's not really a lot of treatments to be able to change that for me. So it's making adaptations that give me a better quality of life is the best way that I'm able to manage it. And I think I would feel crazy if I didn't know that I had it. I would wonder what's going on. Why do I feel this way? Is this normal? And so it definitely brings peace of mind, and just a better ability to cope with the symptoms that do come along with it.
Yeah. No, I mean, we are pushing so hard because we just think that there would be so many different outcomes if people were diagnosed at the point of where their symptoms started. And that could be in childhood, it could be in your 20s, 30s, even older. But the difference that we see from people that are diagnosed as soon as those symptoms begin, you know, not just physically, but psychologically, we're seeing PTSD in people because of not being believed and of constantly having to chase an answer and a reason for all these multi-systemic issues. And I do think if we fix that, it will build such a strong foundation for so much more improvement. So it's, you know, it's great to hear an example of that and see the reality of that. You speak about adaptations, and what techniques have you found useful in managing your EDS whilst doing all your traveling and your work?
Quite frankly, with my job right now, it's been more difficult than any other situation that I've been in because I have a lack of routine. I cope and I manage with routines throughout my day. Has been, you know, especially being a graduate student, it was easy for me to have a set schedule all the time where I made time to exercise and strengthen my muscles, which was the #1 priority. To make sure that I was getting proper nutrition, I would, meal prep my days and always have water with me and got enough rest and had a regular schedule. But all of that's kind of gone away now with the job that I do. And so it's been, quite frankly, very difficult to manage it. The biggest thing that has been able to save me, and something that I do often, is the power of napping. And I know that that sounds a little crazy, but I am a huge advocate for taking a midday nap. That's something that, quite frankly, makes my quality of life and my effectiveness in being able to do my job toward the end of the day, especially if I have an event later in the evening, is a really big tool that I use. Hydration is another one for me. I think I'm not diagnosed with POTS, but I do think that I have some orthostatic hypertension problems or all of those things that go along with POTS. And I seem to find that when I am fully hydrated at all points, I very much perform better throughout my day. And that is pretty much what I do. So staying active, drinking enough water, and trying to take naps is what I do right now. Quite frankly, when I tell people how I manage Ehlers-Danlos, I think that living with this is how you would manage this should be how you really live your life in general, taking care of your body and being mindful of what it needs. I just have to be a little kinder to my body than everyone else is. But I think that it can teach everyone really the steps that are important to be able to take care of yourself so that you can do your job really well.
I'm smiling because that could have been like listening to myself. So in normal life, outside of a pandemic, I'm in a different country every week as well with work. And I always say that it's the routine, it's not so much, it doesn't help with the different foods and things like that, but it's unbelievable how much routine can help with so many things. So I completely echo what you're saying. And it's good to hear we've got similar tips, so they do work. And it's not called it's called a power nap for a reason. There is a lot of strength in a nap. So yeah, no, I'm all about the nap as well, definitely. So what attracted you to pageants growing up, and can you share a little bit about what it's like being and becoming Miss America?
Yeah, so I first started competing in pageants per se, and I use my air quotes because sometimes that's always associated with like the little girls with giant tiaras on, with the spray tans, and that was not what I did. I was attracted to it because I was someone who never had performance or on-stage experience as a kid. I was a huge science nerd. I loved being outside in the dirt, and I played sports. And so it was a complete 180 from most of what my interests were. But I was starting to get to an age, I was about 14 when I started, where I needed public speaking skills. I needed to know how to interview. I wanted to be comfortable in front of a group that I had not, experienced at that point yet. And not doing any of those kind of performance things in school, competing in organizations like Miss America gave me an opportunity to learn how to do those things, to get up in front of a room full of 500 people and introduce myself at 14 and learn how to interview with judges that I had never met before. And I learned a lot of skills through that. And so when I went off to college, I had done it for about 4 years, and I was able to get internships and interview with companies and be a really successful student who was comfortable presenting in class. And I literally said to my parents, and the joke in my family was, I'm just never going to do it again. Once I went to college, I was like, okay, I got out of this what I was looking for. I don't need to compete again. I'm done. I'm retired is what I would say. But Miss America is this iconic program. And it's been around in our country for 100 years. This year will be our 100th anniversary. It's like an iconic thing. And when I had always been a title holder before, everyone would always ask me, are you Miss America? Are you Miss America? It's like the brand recognition is crazy. It's like when you look at a copy machine and you're like, oh, it's a Xerox, or one of those things that's what you associate. And I never thought that I could ever even compete for Miss America because there's a talent competition. And it's not like a America's Got Talent or one of those talent shows. It's particularly kind of limited in what has been there for about 50, 60 years in the history. We typically only see women that are singers, women that dance, play instruments, do baton twirling, and sometimes ventriloquism with puppets. And those are all amazing, but I don't necessarily possess any of those skills. Definitely saw value in it to be part of that historic organization, but also to pay for my graduate education that I had just started. And it's a scholarship program at its base. So I kind of was like, okay, I have nothing to lose. What am I going to do? So I signed up, and I decided to bring my love of science to it and did a science demonstration as my talent, and won my first local competition, won my state competition, Miss Virginia, in June of 2019. And then 6 months later became Miss America. And that was completely unexpected. It was kind of a might as well try this just because I have nothing to lose moment. And that turned into me being the national representative 9 months later. And so it's been a little crazy, but it's really cool to be able to represent a program that has been such a large part of our country's history, and holds so much value, and also to kind of change what that looks like as we move into a new century in the organization, and to continue to keep it relevant for young women.
That's amazing. And I mean, what do you think the impact of you doing that science demonstration as your talent will have on future pageant contestants? I mean, do you think that there will be now much more of a focus on academic talent?
I hope that the impact is more than just from the academic perspective, but just allowing every young woman who goes and competes there to know that they don't have to fit in the mold. They don't have to be like everybody else, and that it's totally okay. Because if you're not a science person, if you're not super academic and you have another talent, if you're a talented, artist or instrumentalist or anything that you do, or whatever you are, to be able to own that and know that you can be completely different and you can be like no other Miss America before, and that you can come in and be the next person that wins that job. That is the biggest thing that I want people to realize, because I was afraid. I was like, I'm not going to win with a science demonstration. Of course, no one's ever done that before. But in reality, that was what set me apart and made me unique. And it was true to who I was. And that is the most important thing, because even if I had walked away in last place, I knew that I was completely authentic to who I was as a person. And so I hope that that's what future women who come and compete in the organization feel like they don't have to do anything that's not them. That never helps us in our life. And it's so important to stay true to who we are, no matter what age or what gender we are.
Yeah, no, that's amazing. Absolutely amazing. And during the pageant, so this is we're now turning to questions from the community. So these have been sent in, and this one's from Kayla. So how were you able to manage your condition and comorbidities during those pageants?
With great difficulty. I had a makeup station, like get ready station that I shared with another woman, Miss Florida. And the joke was that Miss Virginia, me, was always asleep on the floor, because during our break times, I would finish whatever I was doing, and I had a pillow and a blanket that I brought with me. And in my free time, I would lay underneath my chair at my table and take a nap. And the other girls, I think, thought I was crazy, because they're like, why is Miss Virginia on the floor napping? And I'm like, I need time to rest, and then I'll get back up and I'll be ready to go. And so I took lots of naps on the floor, which is not the most comfortable way to nap, but it was helpful. And I also tried to make sure that I was just focused on the fact that it was only a certain period of time. We were there for about 10 days. And so I'm like, okay, I can make it through for 10 days. I can do anything for 10 days. And was very mindful of the fact that I needed to really be careful about how I was taking care of my body during those 10 days. I did end up getting sick throughout that process, which did not help. But making sure that I got enough rest was my number one priority. And I was able to do that through naps on the floor, and actually just making sure that when I went back to my room at night, that I was actually just going to sleep and not staying up on my phone or doing anything crazy.
And do you find, I mean, especially during the pageants, but in life generally, that you find it harder for people to understand when you're having those down moments because of the nature of it being invisible?
Absolutely. It's very difficult, especially when you are a title holder or if you are Miss America, because people think that you are like a unicorn, that nothing is wrong with you. You've never faced anything wrong. So what's going on? When in reality, I have lots that goes on. I've also struggled with mental illness throughout my life. So I have kind of two invisible things that I face that no one else really sees, and they just assume that I'm fine. But particularly as a title holder with this kind of like physical invisible illness, I use it as an opportunity, like a teaching moment for people that I do interact with, to share the fact that I do have this disorder, and that many people that we interact with every day have invisible illnesses that we don't know about. And that we don't necessarily need to ask about, but that we should be mindful if someone maybe is acting different than we expect them to, or someone we know is acting a little different, to be compassionate and be empathetic to the fact that something else might be going on. But it's definitely a teachable moment, and for that I'm grateful.
Good way of flipping it into a positive, absolutely. So this question is from Christina. She says, I'm so thankful for what you do and how amazingly strong you've been throughout this year. And I know that your entire job description as Miss America has changed due to stay-at-home orders, and you've done an amazing job adapting. Do you ever feel cheated, or are you glad to get some time to wind down and work remotely? And do you think any of this remote work will live on past the quarantine? And how can we help you help others?
That's a really good question. The frank answer for that is I absolutely don't feel cheated. A lot of people have assumed that I do. For me, I had no expectations going into this, because it was just kind of a what did I have to lose opportunity. So anything I get out of this opportunity is more than I ever expected. And so I try to stay grateful in the fact that this is still an opportunity that I would have never had. And particularly with Ehlers-Danlos, the biggest time that I struggle with managing my symptoms is when I'm traveling. So it's given me an opportunity to do my job in a way that's really healthy for me. And so it's kind of a hidden blessing in that. But I've also been able to create content that will live on, absolutely, after I am done my year. I've been making science videos, I've been doing interviews and things that will quite literally be saved on a drive or go on to YouTube after this time that can be viewed for so many other years. I'm particularly interested, of course, in STEM education, and I do a lot of that throughout my year. And being able to come up with video content and share that with kids across the country I'm able to reach more kids with that than I am in person. And so I've been trying to focus on the benefits of that. But of course, it's not how I expected to be spending my year, but I am trying to see the benefit in it. And also, I am a perfect vector to spread coronavirus. So I do my job by staying home to make sure that I'm not the one I'm constantly around people in large groups. That's the primary job that I have. And then traveling on planes. So definitely not the time to do that right now, but doing our best with what I can from home. So I appreciate the kindness and the support of what I've been doing so far.
Amazing. So this one is from Heather. Mm-hmm. She says, first, I want to thank you for your impact on science, STEM, and women, for your standing up as a woman with a chronic illness that impacts your life and career and moving forward, and for taking a stand in the Miss America pageants and using your talent to show that we can be smart and make a big impact. My question is this: as a woman of science and medicine, how do you feel, with your stand being medicine safety, about the movement many are taking on the opioid crisis and the chronic illness and rare disease community, and those who still rely on them so much to safely manage their pain?
This is a question I get all the time, actually. And I was really interested because after I competed at Miss America, I got a few very angry messages from the chronic pain community who were very concerned about my stance on opioids in not using them from a long-term perspective. And for that, it was an educational point for me. But I go back to the fact that most opioids are not indicated for chronic pain. They're indicated for acute pain. And so that's kind of the continuing point that I do go back to. It's a hard thing because I've been in pain and I don't have the same kind of chronic pain that many people with Ehlers-Danlos and other disorders do have. And I can't even imagine what it's like to deal with that type of chronic pain just all the time. But particularly with opioids, there is such a potential for abuse. And there's also doctors who are not mindful about how they prescribe these medications and use them as an easy way to not have their patient have to come back and say, I'm still in pain. And that's really what I'm trying to fight in the country. Not people who are using them because they have pain and they need them, but preventing those who don't need these really, really powerful medications from getting them when they don't need to, when there could have been a safer alternative, and allowing those who are taking them to know the risks, because these medications, more than any other medication probably on the market, are something that comes with such a risk to your life, to your livelihood, the addiction potential of these medications, even, from a physical and a psychological perspective. It's just so great. And if you're not aware, kind of like what we were talking about before of how I'm aware that I have Ehlers-Danlos and I change my life based on that. If you're not aware of the risks of these medications and you're taking them, you can end up in a really dangerous situation. So it's been hard. And it's something, of course, every person in chronic pain has to discuss with their doctors. But I am an advocate for alternative pain relief modalities, if possible. Things that sometimes we don't think about and sometimes even our doctors overlook, like, do you need surgery to cure your pain? Do you need physical therapy? Will that help you? Can we do something in terms of massage or ice or heat or nerve blocks? There's so many different ways that we can manage pain that it's just important to sometimes have a conversation with your doctor if you're on an opioid and just to understand the kind of risks that are associated with it. So it's a complex issue, but it's one that we, I think, need to be aware of, especially as people who have pain in our lives.
Absolutely. Thank you. So this question is from Jess. due to EDS and the associated symptoms being quite unknown or misknown by so many medical professionals, what do you do to advocate for yourself and to educate the medical professionals you work with in order for you to improve your overall healthcare and to ensure that you receive appropriate medical care?
I am a person that makes sure, first of all, that I let every healthcare provider know that I do have Ehlers-Danlos syndrome. I have a little emergency card that I carry with me in case for some reason I'm in an accident and someone doesn't know that I do have Ehlers-Danlos syndrome. But I think it's important to, first of all, tell your provider. If your provider doesn't know what Ehlers-Danlos is, to encourage them to educate themselves on it, number one. And if you don't feel like your provider understands what you're going through or how Ehlers-Danlos affects you, I would encourage you to change your provider. It's important to find in every sense of our healthcare, to find someone who is understanding and willing to meet your needs too. It's a two-way street. And just because someone is a doctor doesn't mean that they're, specifically understanding of every single piece of what you go through. But it's important to find people that are either willing to understand or already do understand. And so sometimes I know a lot of the symptoms and I know how Ehlers-Danlos affects me. So I'm never shy to say, I have X, Y, and Z symptom, but I'm pretty sure it's my EDS. Of course, it's their determination to be able to say whether or not they agree. But I like to just, share my experiences, because more than anyone else, we know our bodies. More than our doctors, we know how Ehlers-Danlos affects us, or any kind of chronic condition. And so it's important to advocate for yourself as a patient. And if you don't feel supported, to find someone that does support you.
Oh, that's so important. It really is. And for those that are thinking on embarking, this question's coming from Courtney, on a medical profession graduate school, that pathway, what would you suggest could make it easier when living with EDS? Did you make any adaptations that made it more manageable?
I did not. I had to go back for a second, because I technically did make a few adaptations to how I managed my graduate program. But it's more due to, I told you I had a few mental illness diagnoses that I had dealt with. And so I actually get extra time on exams. That was something that was easier for me, but that has less to do with EDS than it does for the mental part of that. I'm someone that does suffer with anxiety, especially test anxiety. But in terms of my program, it's not, especially in a pharmacy program, it's not particularly physically demanding in the same way that maybe a medical program would be. The biggest struggle that I had was I did a community pharmacy rotation where I had to stand the whole day. And that's a lot of the time what pharmacists do in practice is quite literally you're standing for your whole shift. Nurses, same with nursing, and medical students and doctors as well go through that frequently. That is not something that my body can do the entire day. I will pass out. I had to be very careful. And I was quite exhausted by the end of the day when I was standing all day long. Actually being in a student perspective, just being in a classroom and sitting for that day, same thing I kind of talked about before, just making sure that I was taking care of myself and managing my tiredness, proactively doing things so I was able to get my rest at night. Taking sporadic naps, whether or not they were somewhere in my pharmacy school building or not, but just making sure that I was taking care of myself. But it was not the most demanding thing that I could have done. Being Miss America is very much harder than doing the pharmacy school, which is kind of crazy. So it's a different kind of hard. Not as cognitively hard, but probably harder in some ways.
Yeah, no, I can only imagine. But we are so grateful for everything you're doing to raise awareness. And I know I speak for many when I say how grateful we are that you are out there representing this condition and that you've taken the time to speak with us today and answer so many questions. And it's really meant the world to so many, and that you have been part of our first ever virtual conference that we have over 1,000 people registered watching right now. So it's truly incredible. how many people are dialing in from all over the world, so many different countries. So it's really amazing, and we're so grateful for you being here.
And thank you for having me. It's really my honor to be able to bring this really to the forefront through my time as Miss America, and just to remind people that, you know, it can be part of anyone's life. And there's so many people that are out there that I think that are probably undiagnosed or misdiagnosed. And so if I can be the person that helps them figure out if they are dealing with Ehlers-Danlos or how to manage it once they are diagnosed, then it is my pleasure to be able to do that.
Well, thank you again, and I hope you enjoy the rest of your time as Miss America, and hopefully one day we will meet in person, as was meant to be this summer, but I look forward to that one day. Thank you again.
Absolutely. Thank you for having me.